All right. So good afternoon, everyone, and welcome to Navigating Desmoid Tumors Part 2, Current Management and Long-Term Follow-Up for Patients with Desmoid Tumors. I'm Brandi Benson from the Sarcoma Alliance, a nonprofit that supports individuals affected by sarcoma, a rare cancer. We offer resources, support groups, and advocacy, including our Assistant Fund program aimed at improving patients and family outcomes. Our event is proudly sponsored by SpringWorks Therapeutic, whom we formed established a strategic partnership with to bring this webinar series to you. This is the second installment of our series, with the first session being available on the Sarcoma Alliance YouTube channel. Together, we strive to highlight current management strategies and long-term follow-up care for desmoid tumor patients. Our goal today is to provide clarity and leave you with more answers than questions for this call. This webinar will be recorded and accessible on the Sarcoma Alliance platform, ensuring ongoing availability for those seeking to deepen their understanding and foster community within the rare tumor and cancer landscape. Okay. So for our agenda today, we're focusing on raising awareness and educating healthcare professionals, patients, and caregivers about desmoid tumors. We'll start off with covering the basics for best practices, give a quick high level of what desmoid tumors are, as well as treatment options. And then we're going to end with our patient journey and their perspective. Lastly, this is a very informal setting. So if you have any questions or comments or concerns, please drop them into the chat channel or to the chat box. And if we have time and it does permit, we'll reach out to those and kind of get those answered throughout the session at the end. So what are desmoid tumors? Joining us today to provide that insight and a comprehensive understanding of disease from a medical standpoint is our KOL, Dr. Weiss. Dr. Weiss, okay, who will share some educational insight at a high level as well as explore the current management and follow up with desmoid tumor patients. All right. So thank you for joining us here today. Before we jump in, we do want to just give a quick high level of what desmoid tumors are in just a second, but we want to know who you are and what your contribution is to the desmoid tumor space here.
All right. Hello, everybody. I'm Aaron Weiss. I am a pediatric oncologist. And although I focus on treating children with cancers and blood disorders, I do have a very special interest in desmoid tumors, both clinically and as also from a research perspective. I currently reside in the state of Maine. And in the state of Maine, I am the primary caregiver for patients with desmoid tumors. So therefore, although I'm a pediatric oncologist, I care for patients through the entire age spectrum. My youngest patients are under the age of 10, but then I have patients that go up actually into their 90s. So it's always interesting when those patients come into our clinic, but they, I think, enjoy the fact that they're able to get information and management through somebody who has knowledge and experience with this type of rare tumor. I've been able to partner with the Desmoid Tumor Research Foundation to help foster a lot of research and opportunities for education for the community. And I'm also involved in research on a national and international level, and currently have helped run a recent desmoid tumor trial through the Children's Oncology Group, which is a pediatric cancer consortium in North America. So honored to be able to be here today to be able to help with some clarification of education and management for these type of tumors.
Perfect. Thank you so much for that. And for those who did not join our first session, can you just give like a quick high level of what desmoid tumors are for those who did miss part one?
Yeah, sure. So as I mentioned, these are really rare tumors. We call them mesenchymal tumors, which is kind of a fancy term for tumors that derive from soft tissue cells in the body, they can appear anywhere, and they can affect the entire age spectrum. They tend to be considered a locally aggressive tumor, and so that they can grow. However, they do not metastasize or generally spread to other parts of the body like other cancers do. Although some patients who have desmoid tumors can have multiple desmoid tumors, we don't think of them as metastasizing as others. They typically occur in about two to five patients per million. So certainly rare, but I will tell you that within those that manage desmoid tumors, we all have a number of patients that we care for, and there's probably more patients out there that we're just not aware of because they don't always make their way to attention. These are diseases that can be very difficult and challenging to manage. Unlike other tumors, desmoid tumors are unique in that they can grow, they can suddenly stabilize and not grow for long periods of time, and they can even spontaneously get smaller or regress um, over time. So the way we manage and treat desmoid tumors is what quite variable and different than how we might think of other cancers that we sometimes and tumors that we sometimes treat because of the fact that the behavior of these are quite unique. We're learning more and more about desmoid tumors. We're learning about why they may form, which ones might be more aggressive than others, and that information has helped us kind of help figure out which therapies or treatments may become available. And as we'll talk a little bit more about, there's more newer uh, targeted type therapies or other local approaches that have become available more recently compared to what we had, 10, 20 years ago to help manage this disease.
hmm Well, thank you so much for that very detailed high level of what desmoid tumors are. What are the most effective strategies for managing this chronic condition, and how do patients, or how does that affect their quality of life for the patients?
Yeah, so the management of these is quite variable, and honestly has a lot to do with the patients and their desires and goals of care. These tumors, depending on where they occur, can cause a lot of symptoms. Pain happens to be one of the most common symptoms that we tend to see. Obviously, if this tumor is in a dangerous area, that can cause significant problems as well. The age of the patient also impacts the type of treatment that we may consider. So when we're thinking about different strategies to treat these patients, we really take all those different factors into account. And the individualized nature of the treatment and management is most important. And so it's one of the things that I spend a lot of time in doing is getting to know my patients and my families and trying to understand their goals, what's bothering them the most, and what their goals are about the management of their desmoid tumor, and that helps me align the therapy that I'm going to recommend for these patients. I will say that for the majority of patients, we try to do a kind of what we call active surveillance approach, where we try to observe these tumors. If they're not causing significant pain, they're not growing quickly, or they're not in dangerous areas, knowing that a number of these will be stable for periods of time and also spontaneously get smaller. So that's really been over the last several years, even though they've been doing that in Europe for some time. In North America, that has not really been the case. Most patients historically were seen by a surgeon and had the tumor removed, and then a lot of them had the tumor recur. And because we know that surgery can sometimes cause these tumors to act more aggressively and recur, we try to refrain from surgery. The
Mm,
other thing that's unique is that these tend to be more chronic, and we think of these as more of a chronic disease. And therefore, the treatment that we are going to consider, we need to consider the short term as well as long term side effects, particularly those that are impacting children.
I love that. And so, just kind of to piggyback off the side effects that you were just talking about, how can patients with desmoid tumors balance long-term treatment options with the potential side effects and risks that kind of come associated with this?
Yeah, so, when you're talking about treatment, obviously surgery has some obvious side effects in terms of the actual result of the surgery, which can be somewhat significant from a healing perspective or function later down the road. But some of the treatment that we use for desmoid tumors can involve certain forms of chemotherapy, as well as other agents that we consider targeted agents that are not technically chemotherapy, but can have somewhat similar or other side effects. Those side effects can cause short-term problems in terms of like affecting patients' blood counts, immune system, nausea, fatigue, hair loss, other issues. And long term, those can affect patients in terms of organ function, as in terms of growth and development. Um, and there are also local modalities like radiation that, although can be effective, can also affect the growth and function of the area of where they were treated. So it really is a balancing act. And I can tell you just from somebody who manages primarily children, I'm very cognizant of the long-term side effects of these patients regarding fertility, regarding growth and development, and that I'm very careful and selective about the medications that I use, and I try to use those that potentially would do the least amount of harm while also achieving that benefit. So these
Mhm.
are ongoing, and every time a new medication becomes available, is either being tested or approved, which there's very few of that are at least FDA approved. It's always a balance between the short and long term side effects, but I think that's a critical piece
Mhm.
of the decision making when patients are trying to make decisions about how they want to manage their desmoid tumor.
Mhm. Do you find that some have to do amputations at all?
So thankfully, we see much less of that. That on occasion, when it's in a location that is difficult to treat, despite other interventions, the tumor continues to grow or cause significant pain or affect a negative effect on quality of life. We do at times consider that, but I would certainly say that that is not the norm, thankfully. But there are times or occasions where something that significant is something that needs to be considered and has been done successfully. But as I said, surgery in most settings is something that we no longer consider frontline, but we always have to consider in the back of our mind.
Right, right. And what role or how important is it to have a team of a multidisciplinary care team playing with helping with patients and those living with desmoid tumors, and how can HCPs ensure the continuity of care over time for your patients?
Yeah, this is so critical. Everyone just kind of thinks of the physician or advanced, practitioner in helping manage these. But in all honesty, it's a significant multidisciplinary team approach. I mean, these desmoid tumors, like I said, are with patients through their life, and there are many aspects of their life that can be impacted both positively and negatively with these desmoid tumors. And so here and in many places, we have a holistic approach, the way we think about and manage these patients. We have social work and psychological support because of all the stressors that go along with that. We sometimes have rehab type assistance with physical therapists, occupational therapists. We have pain specialists. Who oftentimes can help us co-manage pain in addition to the normal medical care that patients receive. And so I think one of the most important things is that when these patients come into our office and our clinic, we're introducing them to these other team members, or at least putting referrals out and getting other people involved and discussing them in a multidisciplinary forum, so that we're all kind of pulling in the same direction and meeting the needs of the patients where they're at. And so this is one of, even though we do this, also it's very similar to how we also handle other cancers that we manage in our practice. I think the unique aspect of this being more of a chronic type condition lends itself even more to having that long-term continuity with a multidisciplinary team.
Mm. And I love how you say it's a chronic condition, because I know we were going back and forth and you were educating me about how it's not something that terms of like survivorship. So can you just talk a little bit about like chronic condition and then like survivorship and like what the difference is with that?
Yeah, I mean, it is interesting. it's not that we never use the term survivor for or survivorship for desmoid tumors, because there are patients that can be cured of their disease. They, for whatever, if they're given medication, it goes away, or have a surgery, it goes away and it doesn't come back. But for the most part, most patients, there's always a risk of it potentially coming back, or it's something that they're dealing with on and off throughout their life. And so I think it's very important that these patients be followed for long. Even when I have patients that have prolonged stable disease, I continue to see them on a yearly basis
Mm,
to monitor and check and make sure that they're not having any new symptoms or something that we need to address, because typically the earlier you identify these type of things, the better.
mhm,
So I think the continuity of following these patients over a long periods of time is most important. And so many of us in who do oncology have survivorship or after therapy like programs for patients, and those are not just for disease surveillance. In fact, they're usually not specifically for that. They're usually for looking at long-term side effects of the different therapies that were used. I think in Desmoid, it's somewhat unique in that it's probably a combination of disease surveillance
mhm,
and continual education, especially as new information becomes available, which is happening at a rapid pace. We're able at those yearly visits to let them know about new trials and new research that we know, as well as to look for and identify any potential issues that we caused potentially by the therapy that we used. And so I
mhm,
think that that is important, that we make sure that we have that in place for patients over their lifetime.
mhm. And are there any latest advancements in treatment options that are available right now? Is there anything that's kind of sticking out to you that's amazing and new, or is it pretty much the same?
Yeah, no, I would say the landscape is changing pretty dramatically. Currently, we have our first FDA approved drug for desmoid tumors, which
Mm,
is nirogacestat, which is a gamma secretase inhibitor.
mhm,
There's another gamma secretase inhibitors that's also currently being studied in clinical trials that's under development, as well as a few other clinical trials for newer targeted therapies that are acting on different pathways within the desmoid tumor and affecting or trying to halt or diminish the growth that we see. I'll say, in addition to the systemic, we call them systemic therapies, or therapy that affects kind of the whole body, there
mhm,
are a number of local treatment modalities that are becoming more, I wouldn't necessarily even say popular, but are being studied more. Those involve there's a term called interventional radiology, which is a specialized radiologist who can do procedures on patients. And there are techniques such as freezing, known as cryotherapy, and also techniques of injecting chemotherapy directly into the blood vessels that feed the desmoid tumor, known as chemoembolization. Those
mhm,
techniques are also being studied in more and more patients in both adults and children. And I do think that has exciting potential of having less potential side effects, and also, causing success in terms of halting the growth of disease and maybe even shrinking disease. So I think in the context of treatment, there are these type of therapies are happening. And then on the other side, with all these clinical trials, we're collecting more and more tumor tissue on patients.
mhm,
And therefore, that is the single best way to learn about how these desmoid tumors act, because we can actually take the tumor samples and correlate it directly with the clinical information that we get on a patient's treatment. And we can actually help predict potentially in the future which patients may or may not require certain therapies up front, and we could maybe save some patients from getting treatment that might have a better prognosis without the need for those interventions.
mhm. Oh, that's awesome. Well, thank you so much for that very insightful overview of current management and long-term follow-up care. So as promised, we're definitely going to be hearing from our desmoid tumor patient coming up next. All right. We
Hi, everyone. Can you guys hear me really well?
can hear you. Yes, we can.
Okay, my name is Carol West, and I am in Southern California. Um, I have The story that I'm going to share with you, the story that I was going to initially share with you about living with a desmoid tumor has evolved. And so there'll probably be a two-part story here. So just strap in and let's get started. I also want to thank the Sarcoma Alliance and SpringWorks and you, Brandi, for inviting me to share my story of living with desmoid tumor today. Um, I was just looking in the chat at Satu. I hope I'm saying it right, from Finland. And so I'm not sure who else here is a patient, but thank you for expressing what you did. So hopefully I'll hit on some points that may be helpful. Um, so my story starts with I've been there. I've heard the thunder, seen the lightning, felt the fear. So I want to correct that because I'm in the midst of recurrence. So I'm there. I hear the thunder. I see the lightning. And trust me, there are days where I'm fighting the fear. Um, my dad used to say that in every life, a little rain must fall. I think that's a lyric from an old song as well. But he assured me that I already had what I needed to weather any storm. I just had to look inside myself and stay strong. But there were times I was lost in the downpour, trapped inside an unforgiving storm, the kind of storm that changes you. And trust, this storm has changed me completely. My story begins when I was in an abusive marriage. At the time, I was focused on trying to leave safely with a toddler in tow. I was making arrangements one day at a time, doing everything I could to keep my daughter and me safe. But then, boom, suddenly, life had other plans, like a diagnosis, surgery, chemotherapy. It started in 2012 with some discomfort in my upper right arm. I could feel a knot growing there. I noticed it most when I started dropping my coffee in the morning. I couldn't hold on to the mugs anymore. And I love my caffeine, so spilling my coffee is like a sin to me. That's when I knew something was wrong. Not to mention, I had trouble cutting things with a knife, and it was painful to move my arm back and forth. A few months after the pain began, I decided to see my primary care doctor. But he wasn't too concerned. He said we should wait before testing, so I followed his advice. But the discomfort only continued. And then about 4 months later, my family and I moved to California for my ex-husband's job. I thought then that it might be a good time to go back and get another evaluation. At the checkup with my new primary care doctor in California, I was kind of afraid to mention the lump because of how nonchalant my previous doctor was. But the problem had become so uncomfortable that I had to bring it up. To my surprise, the new doctor jumped in and scheduled an MRI that same day. I was nervous about how quickly it was all happening, and I realized that it might be something serious. After the MRI, my primary care provider referred me to a cancer center. A team of specialists did a biopsy of the knot. That's when the news came. A nurse practitioner there brought me in and showed me the results. He said I had a desmoid tumor in my upper right arm and tried to explain to me. He was as thorough as he could be about the condition, which at the time was often referred to as being similar to sarcoma. He told me that desmoid tumors are rare tumors that may invade connective tissue. I would consider myself more informed than the typical patient. Um, I'd studied chemistry and biology in college and was always doing research, but I had never heard of a desmoid tumor before. And it seemed that the medical community had some debate over how to classify it. After my diagnosis, I sat down with an oncologist who told me that surgery was my option. They did not offer any other treatment at the time. I remember that my initial concern was mostly vain, I'll be honest. I didn't want to have a huge gash in my arm. But then the real fear came pouring over me. Would I be able to hold my daughter up? Would I be able to participate in her life the way I wanted to and the way that she needed? Honestly, I couldn't even cut a sandwich before surgery. What if I came out on the other side worse than I was before? I tried not to panic, and luckily my entire healthcare team was there for me. My primary care doctor, my oncologist, my surgeon, they were a huge support system for me. So while I was nervous for surgery, I did trust them. I decided to give the okay, and we went for it. After the surgery, we decided we'd check on my progress in a few weeks. And in the meantime, my mom and dad had come out to California for a few weeks to take care of me. They made sure I got my land legs back. They helped me get back into a routine and figure out what my limitations were. I had trouble moving my arm, and I had a lot of physical therapy ahead of me. But it was so nice to see them and have some downtime with them. Little did I know that would be the last time I would ever see my dad. Just months later, he passed away. His death shattered me. When I got the news, it was the most uncanny thing. All of a sudden, I could smell him all around me. I had a shirt of his left over from the last visit, filled with his scent. I curled up with it that night and cried. The next day was a waking nightmare because I was so weak after surgery, my doctor said I shouldn't attend my father's funeral, which was 3,000 miles away. I decided to recover. He said I needed to recover and rest. But I'd always been my daddy's baby girl. We had a very, very special bond. But I took my doctor's advice because I was extremely ill after surgery. And because my surgeon wasn't able to remove the entire tumor during surgery, oral chemotherapy was later recommended. My oncologist wanted to make sure that we addressed any remaining tissue from the desmoid tumor. So that meant I was also in my first chemotherapy treatments. That's around the time when my ex-husband finally gave up. He simply said, I didn't sign up for a sick wife, packed his things and left. After he was gone, I immediately went to pick up my daughter from daycare. Right as I returned home with my child, my phone rang. It was the social worker from the cancer center. She got the version of me that I never want anyone else to see. But instead of pulling away, this woman sprang into action for me and did all she could to help. I was and am so grateful for her. I learned the hard way that even when you're in the middle of a health crisis, even when you're too sick to move, life keeps happening around you. The storm rages on. It doesn't wait for you to catch up and strap on rain boots. It doesn't care if you sink. But as angry as I wanted to be at my health, my ex, my life, I knew what my dad would say. My father never taught us to hate. We were taught to rise above. It was up to us to find the strength within to get through life's worst storms. So I knew I had to honor his legacy by loving the life I had. I wanted to be a model for my baby girl and show her what love looks like, and that includes self-love. My daughter is so much like my father. She has an innate sense of people's needs. She understands and empathizes. But this time, I wanted to show her what mommy was made of. I started with educating myself. I combed the web for any study where the word desmoid popped up. I like to think I became one of the world's greatest researchers for a while. My educational background helped me understand the terminology, but still, desmoid tumors are complicated. It took a while to fully grasp how they worked. I even learned some things here today from Dr. Weiss, by the way. I wish I'd had a chance to meet another person living with desmoid tumors back when I was diagnosed. I had no idea other people were going through this. I was told there weren't groups for desmoid tumor patients because they're so rare. That's why I fought alone for months, then years. I made it through surgery. I made it through an intense chemotherapy regimen. I made it through physical therapy. I learned to speak up for myself. I started asking the hard questions, all while raising my daughter on my own, working to support our family and giving back to the community in any way I could. And eventually, one day, the rain let up. The sky cleared. It took 4 years, but my life became something I loved again. My desmoid tumor remained stable. I no longer had to be in chemotherapy or other treatments. I did have to get a scan done every 6 months to check for recurrence. I also married a man who makes me laugh every single day. He and my daughter are crazy about one another, and they're the best support system a girl could ask for. Now I'm looking forward to my husband's sons welcoming them into our home from Kenya, because that's where my husband's from. Our kids can't wait to all be together in the same place. This change in me, this joy, it's been a long time coming. I owe so much of my progress to my absolutely incredible healthcare team who went above and beyond since the moment I met them. I owe all my happiness to my wicked, smart, and wonderful daughter, my father who taught me to speak up for myself, and my husband who loves me no matter what. And lastly, I want to thank myself. Celebrate how far I've come. Because even on the most impossible days, even through the tears and the blood and the pain, I kept going, kept fighting. No matter how relentless the storm, I will stop at nothing because I am a survivor and I've seen the sun. Now, that would normally be the end of my story. But let's fast forward to now. I'm in recurrence, back on chemo, getting MRIs every 3 months. Um, I have, I'm a woman of a certain age, and so I have other complicated health issues. One of them being trigeminal neuralgia, which is really challenging for me. Um, I'm dealing with a system of government that is constantly changing, and so we're not sure when we're going to get the boys from Kenya to live with us. My husband is heartbroken daily because he doesn't know how this is going to pan out for us. I was wheeled out of my job on a stretcher about 14 months ago. I have not returned because I was in a situation where I was being bullied and retaliated against. And I'm sharing all this to let you know life does not stop. Just like I said earlier, the storm doesn't stop. It doesn't care if you sink, but you care about you. Now though I'm in recurrence, this is totally different this go round. I have a completely different attitude. One, I have I have endured this before. So I learned some things along the way. Now I found a community of folks who have desmoid tumors who I can talk to. As a matter of fact, one of those folks in community was the one who said to me, "Hey, Carol, are you following through on those scans?" I said to her, "Oh, I had to switch insurances and I haven't told the new doctors." And I had excuses, but she knew I wasn't feeling well. And she said to me, you can't do that to yourself. Just like Dr. Weiss said earlier, that follow up is key. It's everything. Um, and I'll be honest, after enduring it the first time, I wasn't anxious to walk into another oncologist's office and have someone say the word recurrence. I'm like, I've been there, done that, don't want to do it again. But I couldn't walk around with blinders. So I'm glad I had people in community with me who gave me courage. And, I still got this beautiful little girl who then was 2, is now 14, and still needs mom and is amazing. So I'm also in therapy. This new oncologist, one of the first things he did, and I love about him, is he figured out where I was. And not only did I need health care and chemotherapy and MRIs, I was going through a personal storm in life where I needed mental health care and strategies for coping because my life was in a constant state of change, just like I'm sure yours is. Um, I am reinventing and rediscovering me, my creativity, my passion, my strength. The reason you see me sitting in this booth is because I've become a voiceover artist in the middle of this. I no longer work in the corporate structure. I can't work in the corporate structure that I was in before because of health changes. And so I had to figure out a new way to feel alive and useful. And this has been it for me. So I just, I hope that my story helps someone understand that I hear where you're coming from, where you may find yourself. I remember Satu saying there was a doctor who didn't treat it with the same care that they would quote unquote cancer. And I've had to say to my oncologist, it was one of the first conversations I had with him, look, don't throw the word benign around at me because I've lost my tricep and a portion of my deltoid. And I can't hold the right arm above my head for longer than a second or two. So when you lose body parts, that's not a benign thing. Benign tends to mean non-consequential. It's quite consequential. So I get where you're coming from. And with that said, I'm done, Brandi. That's my story.
I love it. It was so eloquently told and beautiful and very vibrant. I think it was amazing. But I do have a couple of questions for you. So what other strategies have you found most effective in managing your chronic condition? And how has it like affected your daily life?
Ooh, so for me, again, there's a physical limitation that's there. But in addition to that, finding things that work for me. So for instance, talk to text or adding a component to my desktop so that I don't always have to type or use my hands. That's a really big one. Um, Communicating with my husband, look, having someone come and help out with things in the house every couple of weeks is not because I don't want to take care of my home, it's because I need it. I can't maneuver or do the things that I used to do for caring for my home. Um, Also, for me, it's mental health. I need coping strategies when life is beating what I feel like is beating me down or is difficult, and I need to pull myself out of a funk.
Mhm,
So, I've learned things, little simple things for me.
mhm,
People call self-care, thinking going on a vacation or something big. For me, it's something as simple as nothing interrupts my morning coffee time.
mhm.
It's time for me to evaluate, ease into my day. And I told y'all, dropping coffee is a sin. I love coffee. It's my only vice in life. So it's the one thing that I want to take in the smell, the taste, the sound, and just have my mind be at that time. So again, it may not be something huge or expensive, but simple things where you just have sort of a thou shalt not line. Everybody in my life knows, don't mess with mom while she's having her coffee.
Right. I love that. And are there any like latest treatments that you've explored? Are there any treatments that are different from the first time around versus this one right now? Is anything different that kind of stands out to you with your experience?
Because I am the informed consumer, I did approach my now oncologist and say, hey, because initially he wanted to do surgery, and I was like, hey, been there, done that. That's not a guarantee. And if you haven't had a desmoid tumor patient, let me educate you. And that's kind of how, but he was very receptive, and we talked, and he brought in other colleagues and specialists. So we decided, let's wait on surgery. Let's use the oral chemotherapy that I used before, and that's what we're going with now, and monitoring every 3 months with
Mhm.
MRIs, the growth.
Mhm. And I like how you were mentioning how your healthcare physician or your doctor met you where you were at, and Dr. Weiss was just saying that. So, how was that approach? Did they do that before, or is this something that just kind of manifested and happened this time around?
The first time I didn't know. I mean, I was just fortunate that I had a group of people who were just amazing. I'll never forget when I walked into my old oncologist's office after I had found out about my father's passing, and I walked into his office and I had a horrible attitude. And he could tell something was wrong, something was off with my energy. And he said, what's going on? I said, oh, well, my dad died, but I guess that's none of your concern. And he immediately stopped me. And he said, listen, I'm not here to treat just your condition. I'm here to treat the whole person. And
Mhm,
we had that whole talk. And so I was fortunate. I know there are several people I've talked to who have not had that experience with their oncologist, but I did. Now
mhm,
let's fast forward to my current oncologist. I walked in his office. Well, the first one I rejected and asked for another one, um, because they were sort of talking over top of me and not hearing my what I had to say and about my old medical records from another place. Like, these are things you may want to look at, that kind of thing. And so when I got the current oncologist that I have, he was very receptive. He was very open about he had never had a desmoid patient before. And that scared me at first until I realized just how open he was to the multidisciplinary concept and to reaching out to his colleagues to find the best methods of treatment for me. And he actually listened to me.
mhm,
And that was everything.
mhm,
Um, I'm, I've, I walk on this planet, on this earth, in this skin, in this face. And I know sometimes, there are studies done that, particularly for me, women and women of color are perceived to not even experience pain in the same way as others. They interview doctors after they've completed the first 4 years, before they go into residency, and they gauge that, and they really, that is a popular misconception. So I walk through the door with that spiel every time I get a new primary care doctor, every time I get a new um, oncologist or specialist. And if that person isn't receptive to what I'm saying, that person is not the doctor for me. And I realize that I have choices and I'm going to exercise my choices, that kind of thing. So that's been the biggest thing. I'm so grateful to my daddy for teaching me, you have a voice, use it, girl.
I love that. So that was amazing. It sounds like you are an amazing advocate for yourself. So perfect for that. So I just want to say thank you to you both for being here today, sharing your experiences, sharing your expertise on desmoid tumors. I know I've learned a lot about desmoid tumors, the continuous care from a medical educational standpoint, and again from a patient perspective. So thank you so much for that. And we are nearly at time, but we're going to definitely wrap this up. So today we discussed the perspectives from the KOL and the patient. Our KOL provided insight into clinical presentation, diagnosed the different types of care options, while our patient shared their personal strategies and coping journeys. So this dual perspective enriched our understanding of the challenges and support systems essential for managing cancer, especially a rare cancer or aggressive tumor. So now we want to open it up for any questions at this time. We can definitely set aside if there are any questions. I've got to definitely check the chat really quick. Let me see if I can stop sharing right now. Okay, we're back. Do we have any questions or comments about anything that anybody wants to talk about? I see someone just said, what is a KOL? A KOL is a key opinion leader. They're like the expert in the field, the doctor, the HCP, healthcare professional. So any questions at all? I think somebody wants to reach out to you, too, Carol. Oh, I think you're on mute.
Hey,
Okay.
greetings from Finland.
Hello.
Sorry for my
Hi,
English.
Satu.
It's not that good, but like it's really nice to finally find somebody to reach to, because in Finland we don't have really good like care for desmoid patients, and the knowledge of professionals is really bad. So this kind of information is critical to achieve, so we can like get it out to our doctors. It's up to them how they will take it, but like the treatment is really poor. It's treated like it's a minor acquaintance, like it's nothing. It's like a bad mole or something here. So if you don't, as a patient, know how it's how crippling it can be like a life-threatening situation. But over here, it's not treated like that, and we are in a really bad situation. And because we are a small country, there's really just like maybe 20 patients around here. So the treatment is really bad and the knowledge is really bad. So these kind of places where we can find information and bring it to the doctors, it's really important. So I'm grateful for this.
Great.
I'm grateful for you, Satu. Thank you for sharing, and your English is great. I understood everything you said. I just put my contact information. I just sent it to you in the chat. And girl, keep fighting a good fight. Keep talking to them doctors, get them to understand. I think a lot of times people just don't know what they don't know. You try to give folks the benefit of the doubt, but when you know better, you do better. So definitely keep going with it.
And I'll just say
Which is
quickly.
really okay. Go.
Okay.
Yeah.
I just wanted to mention to both your point and Carol's point that we actually, because of just what you're talking about a lot of providers really not understanding and knowing a lot about desmoid, which is understandable because it is rare. We have started years ago through the Desmoid Tumor Research Foundation an international desmoid tumor board, where we actually present cases from all over the world. We do this on a quarterly basis. It's for health providers only, but it doesn't have to be an oncologist. It can be a primary care provider, anybody who we welcome to present their case, and then we have experts on the call to help them with some of the management or questions that they may have. So although it's kind of on a provider level, you as patients and advocates can let your providers know about these resources, and they're available through the Desmoid. You can look on the Desmoid Tumor Research Foundation website, where Lynn is here advocating for, but those resources do exist now. And so there are opportunities for people around the world. That's one of the reasons why we started that tumor board, just for that reason.
Could I jump in really quick as well? Do we have another minute or two, or are we closing?
Yeah, we have
Okay.
a minute, sure. As long as everybody else is fine with that, I'm totally happy with going over a little.
Yeah, I just wanted to mention, and I guess this would be especially for SAT2. So my name is Lynn. I'm with the Desmoid Tumor Research Foundation. And I wanted to mention also that, you mentioned in Finland that there isn't a lot of knowledge among medical professionals. So we have, and I'm actually going to put in the chat, there is a global consensus paper, which is basically global treatment guidelines for desmoid tumors that are accessible by medical professionals. This is published in English, unfortunately. Fortunately and unfortunately. I'm going to put a link in the chat, and this might be something that you want to share with your provider. And if there's anyone else you want to share it with as well. Originally, these were published a couple of years ago, and this year, in June, there was a revision that was published, and it can only be accessed by medical professionals right now. But there are going to be patient guidelines that are published within this next year. So, like I said, I'll put the link in the chat, and please share this with your provider. Be great info.
I myself, I'm a nurse, so I can access a lot of information, and I know I'm in the line of being a patient and also a professional. So it's if I wasn't a nurse by profession, I would be in a really shitty place with this desmoid. So only because I am a nurse, I've been accessing information, and I can find information. I have connects to doctors who want to find the information, but I'm really concerned for the patients that are normal people that are not into nursing or medical studies. So because of those, we are in a really bad situation here in Finland. We have the top knowledge of medication and everything considering that, but desmoids, they are not considered as cancerous over here, so they are treated in plastic surgery, and they have none knowledge of this. So I'm in a fortunate place that I can access information. So I feel like I've been lucky to have treatments that a normal person wouldn't know how to seek. So it's a really sad situation.
Are there any other
questions
or comments?
I was just going to say there are a lot of resources in the chat. Check them out, Satsu. There are some links in there that you might be interested in.
Awesome. So I love this. I love when we hear from the participants. This is what it's all about. Coming together, sharing resources, the stories of strength and resiliency, and getting together through this together, because it's definitely possible. And you just feel better when you're working together as a team. So I'm really happy that we were able to do this today. Again, this resource is going to be available on the Sarcoma Alliance YouTube channel. And then there's also additional resources that are available throughout the chat. So definitely check those out, save those, send them to your doctors. we're just really happy that we're able to assist and do this and be here with everybody. So if there's nothing else to talk about or anything else to share, we're going to conclude and end our discussion for today.
Thank you for the great opportunity, Brandi.
Of
Carol,
course.
thanks for your inspirational story.
Yes.
Thanks so much. Thank you, Dr. Weiss. Great information. I learned quite a few things from you today.
Awesome.
And thanks, Brandi.
Of course. Thank you for everybody for joining and being here today. All right. Have a lovely day and happy early winter break. We're all deserving of it.
Thanks so much,
Thanks.
everybody.
Bye.
Bye-bye.